Welcome to the COVID-19 Decision Support Dashboard, made possible through the volunteer support of the COVID-19 Healthcare Coalition, a private sector-led response that brings together healthcare organizations, technology firms, nonprofits, and academic universities to preserve and protect the healthcare delivery system and protect U.S. populations during this pandemic. The dashboard is inspired by the National Governors Association Roadmap to Recovery report released in April of 2020. This report recommends key metrics and decision criteria necessary to reopen, manage, and react to the ongoing pandemic. The dashboard uses location-specific data to help governors, mayors, business owners, and other community-based decision makers answer their pandemic-related questions. Across the top of our page, you can see a number of analytic categories that could be used to help determine where specific effects are happening and which categories are directly related to the types of things that you would be inspired to do in order to make changes or policy determinations that would improve your current population's health and well-being. We use data that's publicly available and is made available through a number of different sources and processed through a number of models and other situational awareness tools, as well as other dashboards that are empowered through our healthcare partnerships. From the site, you can choose a number of favorite locations, up to 10 locations in a given time, that can be added to your dashboard to understand where your locations are and how they're affecting your specific regions. If I look at my home location of Virginia and my local county of Fairfax County, I can compare and relate different criteria that provide a set of risk indicators and decision aids that correlate to the types of information and key intelligence questions that I'm trying to answer. Using my map, I can look at a series of different layers, including the one I have displayed here, which is our vulnerable populations layer, as well as other layers that provide information, including things like cases per 100,000 population, to try to understand how many new cases are growing in any given day, or how people are currently sheltering in place compared to the actual ordinance standards and policy restrictions that have been made. Additionally, on my map, I can add point layers to try to see how things like current testing sites are available in my particular location as well, so I can see where tests are available to me and where I may be able to go in order to get tested for COVID, should COVID be a list of my concerns. We organize our site around these decision aids and intelligence questions, of which I currently have several. If I want to understand what is the status of the outbreak, I can look at a set of key decision aids and risk categories that provide a simple red, yellow, and green determinant of whether things are trending positively, neutrally, or negatively over time. Through each of these decision aids, I can look at a series of time series graphs and averages that I can hover over and get additional information to understand how things look at a given time. The intent of the overall red, yellow, and green is to provide a takeaway assessment of how risky that particular decision is against answering this, what is the status of the outbreak question. Scrolling down, I can see who is most affected and at risk for the current pandemic threat. We've organized our information around disproportionate effect on different races as well as different ages. We're also looking at a self-determined anxiety and depression indicator to know how much people are reporting signs of depression or anxiety or grief as related to the current pandemic and fear-based threat in isolation during this crisis. We're very interested in understanding if people are complying with social distancing guidelines. We have an overview of whether or not current NPI policies are in effect, and whether or not people are actually sheltering more in place, as you can see here in both of these locations they are, or if people are freely moving around, which is exposing them potentially to more interactions, which will again increase the probability of infection. Moving beyond that, we're looking at how our healthcare facilities are situated to support surge. We're concerned whether or not our non-ICU beds and ICU beds are currently situated to staff an increase in patients, whether they be experiencing COVID or other related crisis situations in their health. And lastly, we're looking at social and economic determinants to try to understand outside of our health crisis how people are being affected in order to return to some degree of normalcy. Having the opportunity to visit doctors through telehealth medicine is something that is definitely increasing over time, as you can see here. We also have a concern that people don't necessarily have the broadband access to receive the quality telehealth or virtual learning that they would need to receive in order to be able to conduct either health or learning from online. You can see here in the state of Virginia, only 69% of my households have enough broadband access to support virtual learning, which is a concern as a decision maker where I am trying to put most of my students in a virtual learning setting and require them to have access to video, which is not available to roughly 30% of our households. Looking at our economic determinants, we can see how people are spending their money. We can see that people may be spending less money over time, which indicates a potential where people are finding risk in spending money where savings are more important. And we see that our unemployment numbers are significantly higher than they've been in previous years, which is another indicator of where the state of our social and economic picture looks. Overall, the purpose of this site is not only to compare information, but to try to understand what the current roll-up summary is. So you can see that in Fairfax County, I'm currently at high risk, which means I need to be taking certain precautions to make sure people either aren't getting sick or that people are finding resources and means to have a healthy and stable livelihood, which is important to all of our residents. The real goal of this dashboard is to provide a structured understanding of how a state or county is performing. And we do this in a way that's critical by rolling up what is normally complex information into a series of information that's more easily and readily understood. Our new search capability, which I demonstrated earlier, is also a way to find information that not just is at state or local level, but we can search where all hospitals are, or we can use specific place names to try to understand where locations of interest might be. I encourage everyone to visit this site often. This is a site that we update every couple of weeks, and we always are looking for new information, new data, and new intelligence questions that guide our decision making. So I encourage you to visit us often, and please deliver us any feedback you have. We look forward to any opportunity we have to help our communities and help our decision makers make better decisions. And again, this is the COVID-19 Decision Support Dashboard. There's a link to the site in the YouTube description, and I appreciate your time.